All right, good afternoon, everybody, and welcome to the latest edition of the Lunch and Learn series put on by the Chicago Asthma Consortium. This particular forum is specifically for school nurses to learn about just how to manage and mitigate asthma symptoms within a school environment. And I'm absolutely thrilled to be having this discussion. We'll talk about my bio in a second, but I work with schools all the time and kids who have asthma. So this is a topic that's near and dear to my heart. And we can go to the next slide. So the topic today is managing asthma in schools beyond the basics. And this, as I said, is specifically for school nurses and other people who interface with folks who have asthma in a school environment. Next slide. So I'm the moderator today. I got to get a new picture. I was staring at the sun when I took this. But I'm Matt Seamer. I'm the executive director of Mobile Care Chicago. We have three asthma and allergy clinics that are mobile clinics that travel around Cook County and Lake County and provide free specialist care for kids who have asthma and allergies in partnership with schools. So we work with over 150 schools to provide ongoing, continuous asthma and allergy care for kids. And we see kids from as young as 6 months old all the way up until folks graduate from high school and are going on into college. So um, through our program, through 25 years now, we've interfaced with literally thousands of children who have asthma and also have partnered with school nurses to make sure that they get the resources that they need and also that the schools have all the information necessary to be able to manage this disease. So again, I'm thrilled to have Gloria here and to be having this conversation today because it's so important for kids with asthma. Next slide. So today, the just a little bit about the agenda. We'll just do a quick overview about the Chicago Asthma Consortium and who we are. Then I'll introduce Gloria, who will give us her presentation, and then we'll also make sure that we add in some time for question and answer, so that if folks have stuff that comes up throughout the presentation, we can make sure that you get the information that you need. We'll plan on closing promptly at 1:30. So we'll do our best to stay on time and ultimately get you all out of here before that 1:30 mark. Next slide. Uh, a couple of housekeeping things. First of all, you're not going to need your video and audio today, so you can mute those if you haven't already. If you have technical difficulties, you can contact Kay in the chat, or you can contact the info address for chicagoasthma.org. Um, we encourage everybody to introduce yourself, say hello, say where you're from, just how you're sort of interfacing with asthma issues in your particular school. And just, if there's information that you want to share or information you want to know, by all means, put it into the chat. I'll be active in the chat. I know a couple other folks will as well. If you have questions for Gloria, you can type those in the chat as well. And as the moderator, I'll aggregate all of those and make sure that we get your questions answered at the end. And then at the very end, we'll also have a survey that gets put up. I would encourage you to please fill out the survey. Um, we take the responses very seriously, and we use that to generate content that is going to be interesting for you in other forums. So if there's topics you want to know about, you can put it in there. Or if there's other things that you feel like we could do differently or better in these lunch and learns, then you can put that in there as well. And next slide, please. Just a little bit about the CAC, and I'll keep it very brief. The Chicago Asthma Consortium has been around for 30 years now, and what we do is that we seek to improve the quality of life for people with asthma through three main pillars: advocacy, education, and collaboration. And really what we're trying to do is be a convener for a number of people who interface with folks who have asthma or have asthma themselves, to raise awareness of this disease and also to promote education about this disease, advocacy, policy changes that can make it easier for people with asthma to live a healthy life. So if you're interested in learning more about the Chicago Asthma Consortium and what we do, you can go to our website, chicagoasthma.org. We'll also put that into the chat later. You can also become a member of the Chicago Asthma Consortium, and all donations that we receive go straight back into community work to make it easier for folks with asthma to get the resources they need. So we appreciate the support of all the folks who are members who are here. Next slide. And ways you can help. We have a variety of committees that are all volunteer. We have a community advisory board that weighs in on research projects that folks are doing around the city. We have a community engagement committee that's doing direct education to folks who have asthma. We have a fundraising committee, a membership committee, and then a professional development committee, which is the committee that puts on lunch and learns like this one. I should mention, I'm the president of the board of the Chicago Asthma Consortium. I've been a member for 13 years now. I love the work that CAC does, and I serve on the professional development committee. So I would welcome any conversations with folks who are interested in knowing more about what those committees do and how they can get involved. You can also contact the info address if you don't want to email me directly, and we'll make sure that you get the information you need. Next slide. Finally, to the main event, and I'm very excited to introduce Gloria. So Gloria Barrera currently works as a certified school nurse at a public high school outside of Chicago and is visiting professor of nursing at the University of Illinois at Chicago. Gloria was the first Latina president of the Illinois Association of School Nurses and also served as the secretary of the American Nurses Association, Illinois. Gloria was appointed to the IDPH Diversity in Healthcare Professions Task Force, as well as the Governor's Illinois Terrorism Task Force's School Safety Committee. Gloria has demonstrated her deep commitment to helping others through her volunteerism and community service with various nonprofit organizations. She is the fellow, she is a fellow of the Alliance of Nurses for Healthy Environments, a Climate Health Organizing Fellow, and co-founder of the Nurse Heroes for Zero. Gloria is considered a subject matter expert in school nursing, environmental advocacy, health equity, and public health. Gloria is invested in mentoring the next generation of school nurses as co-founder of the Society for Latinx Nurses. And as I said, I'm very excited to introduce Gloria, and I've been eager for this presentation. So Gloria, thank you for sharing your knowledge with us today, and I'll pass it over to you.
Thank you. Thank you so much, Matt. We can go to the next slide. Thank you. Um, maybe that is okay. We're there. We're back to the beginning. Good afternoon, everyone, and thank you so much for joining me today. I know how busy all of our days can be, so thank you for taking the time to just sharing 30 minutes and counting. Right, we're already on the 108, so I will make sure that I speak fast so that we can get out of here at 1:30. My name again is Gloria E. Barrera. I am a public health nurse. I specialize in school nursing. And as you heard in my bio, I stay actively engaged with the profession. And I really had the pleasure of joining the Chicago Asthma Consortium's education committee and am the creator and organizer of our Lunch and Learn series exclusively for school nurses by school nurses. So by me, I'm one of you. So as a school nurse, I really am thrilled that you're here. Today's session will be focused on real world strategies that will hopefully empower you to support students with asthma, not just reactively, but proactively. Next slide. So, why this matters. Asthma affects right now, we know, 1 in 12 children and is one of the leading causes of school absenteeism nationwide, but we can see that right within our school buildings. As school nurses, we aren't just healthcare providers, we're public health advocates, we're educators, and we're frontline responders when it comes to asthma. Organizations like Rescue Illinois that I'll be discussing are helping to tackle that asthma equity really head on, because we know that asthma doesn't impact every community equally. When we address asthma effectively in schools, we directly support healthcare, academic success of our students, and health equity again. Next slide. So today's focus will center around three major areas. That's going to be first, how to implement and maximize the use of the asthma action plans. Second would be how to identify and reduce common asthma triggers within school environments that you can control. And then the third would be how to confidently respond to asthma emergencies when they arise. You'll leave today with practical strategies and tools to enhance your already existing asthma care in your buildings. Next slide. So we'll quickly just start with asthma action plans. This is probably an overview, but one that I'll still, share. A strong plan clearly outlines the student's asthma severity, medications, known triggers, and of course those emergency contacts. We're all familiar with the spotlight model, the green, yellow, the red zones. It's really useful for the school settings to guide quick decision making. It's essential that these plans are updated annually, and we know that when we're following the state board of education rules and Illinois Department of Public Health's recommendations, they need to be updated annually. And it's important that our staff, those that we work with and that work directly with that student, that they're familiar with an asthma action plan, and that they're accessible. So plans should be available in your health office. Copies should be given to classroom teachers or uploaded into whatever electronic system you use at your school. And it should probably be carried with students if they carry their asthma inhalers if you're working like in a high school. Next slide. So it's one thing to have an asthma action plan, and it's another to know how to use it in real time. The staff should be trained to reference the action plan immediately during symptoms. Rescue medications like albuterol must be stored again in that secure but easily accessible location. Most often, it's in the health office, but we know that in Illinois, everyone can carry their albuterol inhaler or their emergency inhaler with them, on their person. But we want to make sure that it's not in any kind of hard to reach place and that it's not kept locked away, in a medication cabinet where it's not easily accessible if you're absent, one day or if you're not in the building. I also strongly recommend scenario based training. So that would be practicing mock asthma scenarios. It really does help staff become more confident, and it reduces those hesitation moments in emergencies. Next slide. So, what are common school triggers? A major step in managing asthma is knowing what triggers will, trigger the asthma attack. So that's common indoor triggers would include dust, mold, classroom pets, for example, if you're dealing with little ones that have maybe like a hamster in their classroom, and even certain cleaning products. Outdoor triggers can include pollen, air pollution, and cold air, for example. All of these are relevant to the school setting, and to even school activities such as recess or outdoor PE, and during arrival and dismissal times. I think it's important to note here that according to the American Lung Association's latest State of the Air report, nearly half the US population lives in areas with unhealthy levels of air pollution. And this includes the fine particulate matter and ozone, both of which can worsen asthma symptoms. And we know that communities of color, like the ones that many of us serve, are disproportionately affected. In fact, Latino children are 3 times more likely to live in areas with triple failing air grades. We can play a huge role by advocating for healthier environments, better ventilation in our school buildings, fragrance-free, cleaning supplies, and policies that limit exposure. We'll learn about the advocacy efforts in our next lunch and learn, event within the series of three that we're going to be having. But please be aware that your voice is powerful as a school health expert and as a registered nurse. We really must continue to fight to be included in decision making spaces where public health, especially school health, is being discussed, and we really are the ones that connect. We're the most connected to the issues, and we can weigh in on um, information to better the issues with just our expertise that we already have. Next slide. So here we're going to be looking at family engagement and then the trigger reduction. Managing asthma isn't just a school responsibility; it's a collaboration with families. So discussing both home and school triggers with caregivers during meetings that you might have with them, whether it be open house, whether it be an IEP meeting, a 504 plan meeting, if the student has access to both or it's qualified for both, and also we need to recognize that we have shared trusted resources at our fingertips, like the National Association of School Nurses Asthma Toolkit, so that families can replicate school based best practices at home. And consistent environments between home and school, we've already seen the research, it significantly reduces asthma exacerbations and by and large the ER visits. Next slide. When an asthma emergency does occur, quick action is life saving. We all know this. Symptoms like wheezing, inability to speak in full sentences, cyanosis, depending on their skin tone, we can see the blue lips. Immediate response is needed, and always follow three basic rules, but also following the Illinois Rescue guidelines and IDPH. Never leave the student alone. Administer rescue medication immediately, especially if you have that stock albuterol, undesignated stock albuterol on hand. Use it. Call 911 if there's no improvement or if symptoms worsen. We're going to align our emergency standards with, again, Rescue Illinois recommendation, NASN's best practice, so the National Association of School Nurses best practice. And that's just to ensure consistency across the state of Illinois. If you're not already familiar with Rescue Illinois, they are an organization behind the mass rollout of stock albuterol medication in our state. We're actually one of two states in the US to have this program. So please connect with me if you need more information on signing up your district. It's very easy. There is a mandated training component to it that they offer to all of their participating schools. There is going to be one left in May, and I am one of the presenters. And if you're unable to attend the one in May, you could always catch the on demand training as well. Next slide. It really does take a team, and one nurse cannot do it all. Although I know sometimes it may feel like we're the only ones doing the work. Please use the delegation checklist from NASN, from the National Association of School Nurses, to assign tasks properly. And remember that delegation isn't necessarily abdication, but it's empowerment. So document those staff competencies after training sessions and follow up periodically to keep those skills sharp. We're also making sure that you're building a trained network, and it building that trained network ensures that no student is ever left waiting for care if a nurse isn't immediately available for whatever reason. Hopefully, in your schools, in your districts, there's one nurse in every building. But we know that the data will suggest otherwise, and we're working hard with the Illinois Association of School Nurses to make sure that every child in Illinois has access to a school nurse every single day. But we're not there yet, and we are working to get there, but we're not there yet. So making sure that you do have that trained network really ensures that no student is left waiting. Next slide. One way, again, to immediately improve asthma safety is advocating for stock albuterol availability in your schools if you already don't have that access. And Illinois law, again, it allows schools to stock emergency inhalers, but protocols may vary by district. And also, there may be just lack of awareness in your district if you don't have access to stock albuterol. Promote those standing orders, have the clear storage policies and proper documentation. In my work with Rescue Illinois, stock inhaler programs have been really transformational for student safety, and they really do save lives. Next slide. So, tools that you can use, you don't have to build systems from scratch. The National Association of School Nurses has the asthma toolkit. It offers templates for plans, it offers checklists for emergency prep, and handouts for families. Self carry, readiness forms ensure that students who are able to manage their inhalers responsibly, they have that documented and ready to go staff training materials, those modules may standardize what everyone knows already about asthma response. I'm not sure in your district, but in my district, we have it's the mandated trainings, and there is an asthma component to it. But I've heard already from many people that I have to do additional training because all they do is just click through it to make sure that they get their certification at the end, or they check off a box. So I always make sure to refer them back to that training, and exactly I tell them what minute that is. But I also supplement that with my own training, and that's because I'm ensuring that I'm building a network of trained staff members. Next slide. And here's the reflection questions. Before we wrap up, I want you to really think critically about your own school, about your own space and what you can control. Are all students with asthma properly identified in your building? So that is, if there is a sub nurse for you, or if there is a substitute teacher, will they know who your students with asthma are? You can always start there and create whatever you need to make sure that that's clear and there's no confusion. Another reflection question is, are rescue medications accessible and known to the necessary staff members? If not, then that's when you're going to be able to have a starting point there for immediate action. When you're able to look at, well, yes, medications, but they're kept in the locked cabinet, and if I'm out for lunch, nobody can access them. You want to make sure that you're starting with these two questions if you already don't have a great protocol in place at your school, at your district. Next slide. So here are just final takeaways. Asthma equity is public health equity. As school nurses, we aren't just managing medications. We aren't just managing, the inhalers. We're addressing social determinants of health. We can teach families how to manage asthma, but we also have to advocate for cleaner air. So as nurses, our role extends beyond the school building. We can also be powerful voices for policies that protect the air that our students breathe. Your role really does matter. You are frontline advocates. You're ensuring that every child, at least that's what we're working towards, regardless of their zip code, has the ability to breathe safely and learn fully. Next slide. It is 1:24, so we'll be taking questions, but I just wanted to really thank you for your time, your attention, and the work that you do every day. I'm proud to call you my colleagues. If you'd like to continue learning, please connect with me. I'd love to collaborate and share more about the Rescue Illinois, that training that I mentioned that's coming up in May. I'd love to collaborate with you. And let's keep building asthma friendly schools together. And please don't forget to register for the next school nurse lunch and learn series, where we're going to be talking about the advocacy component.
Wonderful. And thank
Thank you.
you so much, Gloria. I do have a couple of questions. I know that we've only got 5 minutes, so I'll try to keep them brief. But One that I wanted to ask you about was the train network that you were talking about earlier, which, making sure that like if there's not a school nurse who's immediately available, that there are other people who can play a support role. Um, I was wondering if you could talk a little bit more about that. And like who are some of the usual allies who you would bring in to kind of cross-train them or help them understand how to respond in case of an emergency?
Yeah, I can speak personally to having, if there's not a nurse available, because in my district there are three registered nurses, including myself, that manage the office that are available during the school day, and we also have an administrative assistant. But when we're looking at schools that don't have a nurse in their, in their building every single day, it would be training, almost administration. But here in my school, those people that I consider part of my training network, my training team, would be security, and it would be the deans, and then our team here that would include the administrative assistant, so the secretary, and also the administrative team. So we have already emergency response protocol, which a lot of us, on this call, we're probably seeing what that can look like with any kind of emergency when we're looking at the cardiac emergency response plan that just rolled out. That was mandated, January 1st of this year, that you had to have a response team in place. Looking at that response team, whatever that response team is in your school, and you have to have it because ISB already mandated it, so you have to have a response team. And if you don't, you can you can email me, and I'll share uh, the law with you so that you can share it with your administrators. But whoever's on that response team would be the ideal team to then carry out any kind of emergency response, and it would include asthma, for an asthma attack. So it would be, again, for us, the security, deans, administrators, the team here that I work with, and then after school it would be athletic trainers and also security. So I am curious about what that looks like in your schools, if you want to throw that in the chat. But that's who would be part of your trained team, response team. But I did mention that all staff members need to be made aware of students with asthma. It should never be a question mark. It should never be, well, I wonder if he does because he looks like he's having an asthma. It should be, there's a red flag on the database that everybody uses, whether it be eSchool, Power School, whatever you use in your school building. There needs to be an alert of them having asthma, of which students have asthma, which students have seizures, which students have, anaphylactic allergies. It needs to be clear. And if it's not, that's where you start. That's step one.
Perfect, thank you. And with carrying medications and also with stock albuterol, I know that there's been a lot of conversation around like what qualifies as a as an emergency medication and what sort of medication should be the responsibility of school nurses, and especially now that smart therapy is becoming a little bit more widely known, and Symbicort and Dulera
Mhm,
can have an emergency function,
mhm.
even though they are previously were considered purely a control medication. Um, I wonder if that complicates any of the sort of like decision making processes or this sort of triage that you have to go through when you're determining, okay, a child has asthma and like their asthma action plan says they're on these medications, and like what does that mean to make sure that everyone's fully trained on how to use these? Like, do you find that that's more complicated, or is it the same sort of process but just like with a couple wrinkles?
Yeah, I don't think it's complicated. For school nurses, it's not complicated. But when you're looking at buildings that do not have a full-time, registered nurse, I think that is the basis to demanding it, to that
Hmm.
parent demanding that their child has access to a school nurse, because then we can perform an assessment and really see what zone they're in, and administer that. the stock albuterol or whatever medication we have on hand that they're prescribed. I say stock albuterol because that has been a big win here in Illinois because before that it was we're calling 911.
Hmm.
If we don't have medication, to this was, we're talking about 5, 10 years ago. If we don't have medication on hand for this student, if they weren't prescribed medication that we have on hand, we were calling 911. And that was just a big barrier of why can't we have emergency, stock albuterol if we have emergency EpiPens, if we have emergency glucagon, for example, right? So I think that is a big win. But when you're saying when you're asking if it's hard, it's not hard, but it's because we have that expertise already. We are, professional registered nurses. We're licensed. We have that expertise, and it would be very easy to follow along an asthma action plan. It's just um, making sure that every student with asthma has an asthma action plan is also the next step, and it's a big step because we're asking then families to get connected, and I'm familiar with the mobile van, so making sure that they know about those resources too in the community is really important.
Yeah, I really appreciate that response, and the advocacy lens that you give to it. That because I agree with what you're saying that like this is not difficult for people who for whom this is like your professional training, and
Mhm.
the for kids who have asthma, especially young kids who might not know the ins and outs of these medications themselves, having someone on staff who is a qualified expert in this makes all the difference. So I really appreciate you pointing that out. Um, I know that we're a couple minutes past time, so I think we'll end there, but this is actually a great segue to the next lunch and learn that you're going to be doing. So
Right.
I hope folks will come back and will join for the second one. And Vicky asked how you can register for the training in May, and that'll be through the CAC website, chicagoasthma.org. And again, I just encourage everybody to fill out the survey, and if there are other topics that you'd like to know about, make sure that we're aware of that, and um, we'll aggregate that and make sure that we put resources together. But thank you, Gloria, for
Thank
helping us
you.
today. And what a great presentation. And all right, till next time,
Thank
goodbye,
you. Bye bye,
everyone.
everyone. Bye bye.